I'm going to first talk about the healthcare barriers experienced by many autistic people. Traditionally, our approach to supporting autistic people is to teach them the skills they need. This meant we often looked at the limitations of people with a disability and saw these limitations as their problem. There's the assumption that we have to teach them how to communicate better, develop social skills, and how to make eye contact. Basically, how to become successful in a neurotypical world. This lens of looking at autistic people comes from the medical model of autism that sees autism as a deficit, and the autistic person has to change to fit in a neurotypical world. However, there's a surge of research on what we call the double empathy problem. Double empathy says that social interactions are bidirectional. Autistic people may not understand the social interactions of people who are not autistic, but equally, people who are non autistic often do not understand the social interactions of autistic people. Both parties may struggle to understand each other's thoughts, feelings, behavior, and differences. This becomes important because solving this relational problem then becomes the responsibility of not just the autistic person, but both parties. And that's why now we're moving away from the medical model of looking at autism and embracing a strength-based social model of autism and disability that sees opportunity in focusing on people's strengths and adapting the environment to better support the autistic person and embrace their unique perspectives and being in the world. I'm going to talk about a bit more about this later on. Triple empathy draws attention to the fact that within the medical context, we are not only talking about a mismatch between communication and understanding between an autistic person and a non autistic person, but also adding the mismatch between someone with medical literacy and someone who is not a medical professional. Understanding all these mismatches can help us see why there are so many barriers to healthcare for autistic patients. Autistic people experience significantly poorer health outcomes and higher rates of early mortality compared to their non autistic peers. Many of these outcomes are not due to autism itself, but to barriers within our healthcare systems. Many of these barriers have been attributed to a lack of autism knowledge and awareness among healthcare providers. There's a huge body of research that shows autistic people face significant barriers to healthcare and consequently have poorer outcomes. And let's briefly look at this table by Arnold and colleagues, published in 2023, to see a few of these barriers. We choose this paper because it includes an Australian sample of both autistic and non-autistic adults. So participants in this study completed these items shown here with either a yes or a no response. Some of the main barriers have been highlighted on this slide. And as you can see, a significant amount of autistic people experienced trouble following up on care, trouble identifying and reporting pain or other physical symptoms to their healthcare providers, sensory discomforts that get in the way of healthcare, and difficulties handling the waiting room. So these findings are for general healthcare. So if we think about these within the context of maternity or early parenthood care, we can understand how these types of barriers may impact good maternity care. So it was papers like this one, as well as the interests of Australian practitioners, that led to our study led by Abby. Both Ainsley and I will go through some of our research findings just in a bit. So if you think back to the double empathy and triple empathy problems, there's a number of mismatches that can occur between an autistic consumer or patient and non-autistic healthcare professionals. First, there may be communication mismatches. Many autistic people communicate in ways that differ from non-autistic professionals. And this mismatch can lead to misunderstandings, misdiagnosis, or inadequate care. For instance, someone may not describe pain in a typical way, or may not respond to open-ended questions in the way doctors expect. And then we may have lack of provider knowledge, assumptions, and stigma. Many healthcare providers receive little to no formal training about autism, especially in adult healthcare. And as a result, clinicians may hold outdated assumptions or misunderstanding signs of distress, overload, or shutdown. Research findings indicate that dismissal of patient concerns or attributing patients' concerns to autism instead of being taken seriously are common. These issues contribute to diagnostic overshadowing, where serious conditions are missed due to assumptions about autism. Sensory environments. So, healthcare environments are often overwhelming. Bright lights, unpredictable noises, crowded wait rooms. Who likes hospitals, right? For autistic patients, sensory overload can make it particularly difficult to concentrate, communicate, or even stay in the clinic. The systems are not built for autistic people. Booking appointments, navigating Medicare, filling forms, these systems often rely on executive skills, executive functioning skills, that may be challenging for some autistic people. Many services also don't make it easy for support persons to attend or refuse to make reasonable adjustments. And then finally, we have intersectional barriers. We have to remember that barriers can compound. The barriers I've described are often worse for autistic people who are also multiply marginalized. For example, autistic people of color, those with intellectual disability, LGBTQIA plus autistic individuals, or people with limited income or rural access. We want to briefly share our findings in this research. So in this study, we asked Australian clinicians to describe their experiences supporting autistic people during the perinatal period. The professionals included midwives, nurses, and doctors. We asked questions about the challenges and support needs of these professionals. So this figure here shows the themes that came out of this research, and I just wanted to highlight a few of them. Clinicians in our study had great ideas and strategies for how to provide person-centered care for autistic people. They knew that we needed to also address the larger culture at the hospital and embed neurodivergent acceptance. As one clinician mentioned, I didn't have this woman for very long, but I just was like, oh, I saw that you're autistic. Do you have any particular needs or preferences? I know it can be really overwhelming. Although the professionals had the right motivations, we identified these four barriers across all professional roles. So all our healthcare professional participants said they did not receive training in autism or neurodiversity. All participants mentioned policies that were serving as barriers for autistic people. So policies, for instance, that don't allow for continuity of care. The autistic professionals who participated shared they did not disclose their autism in their workplaces because of the poor attitudes around neurodiversity at the hospital. One participant stated, as a newish colleague, I don't think I would ever tell anybody that I was autistic. Some participants described feeling like outsiders in their workplaces. They asked the question to themselves, how can we provide better care for autistic patients if autistic employees don't feel safe disclosing? And as illustrated by this quote on the left of the slide, a participant said, it's not visible in the hospital. So if patients are coming in and seeing that staff are not open and safe to be open about their own identity, then how can they feel safe in the care we provide? So overall, our findings from the professionals study demonstrate a lot more work is needed from the hospital system's perspective to enable neuroaffirming care. So let's briefly go through neuroaffirming care. What is it? Well, this is an approach that acknowledges and accepts the natural variation in human brains rather than viewing it as a deficit or disorder. It focuses on the unique strengths and support needs of people. Again, it's stepping away from just the medical model that sees the autistic individual as the problem or a puzzle to be fixed. Now, the autistic community calls for us to provide neuroaffirming care. And this care is more than just person centered care, in that it actively promotes environments and support systems that accommodate diverse neurological profiles. Um, so what we're calling for is really a neurodiversity approach to healthcare. We wanted to share this table with you, developed by Patrick, our research friend at Olga Tennyson Autism Research Centre. Patrick's argument is that both the medical and social models of disability have merit, and we need a neurodiversity approach that takes both into account. So, from the lens of a neurodiversity approach, disability results from the interaction between the individual differences and the society or environmental factors. And the focus should be on valuing the diversity of minds and brains, addressing both the individual needs and societal barriers. The goals of intervention should be to enhance the quality of autistic people's lives through acceptance, support, and appropriate interventions tailored to individual needs. Our ARCAP team loved this more balanced approach, and that's why we really want to share this with you. Finally, another thing we wanted to share with you is this SPACE framework. So Mary Sue and Sebastian developed the Autistic Space model to offer healthcare professionals a simple framework that promotes accessibility without adding to current clinical burdens. So SPACE stands for sensory, predictability, acceptance, communication, and empathy. They provide a long list of sensory recommendations targeting various senses from sight to touch. Their recommendations around proprioception and interoception and pain are especially relevant in the healthcare setting. The recommendations around predictability include providing information to patients ahead of time, creating clear signage, and providing a social story. This framework pushes for autism acceptance, not just autism awareness. For communication, the authors highlighted numerous communication differences experienced by autistic people. And the fifth category, empathy, is around educating healthcare professionals on how to recognize empathy in autistic people and also how to empathize with their autistic patients. This recommendation arose due to the double or triple empathy problems. We highly recommend checking out this paper. They've got an extensive list of recommendations.